Isha ma'am, please start your video.
Recording in progress.
Hello everyone, and good evening, ma'am. I'm Dr. Isha, nephrologist from India, representing the social media team of WIN India, to get in talks with Dr. Anuja Java, one of the international speakers at WIN Icon 2022. Ma'am is the director of kidney transplant at Washington University, St. Louis, and she's a well-known name in her domain. And those who are active on NEF Twitter know very well how she actively keeps sharing the immense knowledge she has gathered so far. So she definitely has special interest in transplant complements, and she'll elaborate and let us know further what are her current research works that are ongoing.
Definitely. It's a pleasure to be here, Isha, and thank you so much for conducting this interview. So, of course, I'm excited for the coming weekend and for the WIN India talk. But in terms of what is ongoing currently, as you said, my focus of research is really complement-mediated kidney diseases, particularly atypical hemolytic uremic syndrome and C3 glomerulopathy. But very interestingly, most recently, I got grant funding to delve into looking at the role of complement in preeclampsia. So my current research that I'm working on is actually figuring out if there are genetic mutations that predispose a subset of high-risk patients who develop preeclampsia and then go on to develop end-stage kidney disease. So that's kind of what I'm excited about. It's a new area that I'm delving into.
Indeed, that's very novel and interesting, ma'am. And as a resident of nephrology, I remember gaining some pearls from you through NEF Twitter, of course. I remember how you highlighted a few factual points about a case when I was in the dilemma sort of a thing about a case with atypical HUS. So thank you again for that.
Absolutely, my pleasure.
Your talk, ma'am, at the WIN Icon, the first WIN Icon which we'll be having at Hyderabad, would be about genetics in HUS. So could you be please briefly telling us about what would be included in all your talks?
Yeah, absolutely. So the topic that I've been assigned is atypical hemolytic uremic syndrome, unraveling the genetics. And I think it's a very timely topic and a very important topic because we know what atypical HUS is. I think the conundrum or the challenge that a lot of clinicians face is that when you get the genetic test report on these patients, how do you really tease out or figure out whether genetics is involved in these patients? And if there is a mutation, what it means? How do you interpret it? How do you go about analyzing it? So what I'm focusing on is going to kind of start from beginning to end about what genetics in AHUS means and how do you really go about, in a particularly case-based study, how do you go ahead and identify what that means for a patient? And I will be talking about a real life case that is from our practice to kind of really put things in perspective on how we do things genetically for these patients. So my focus is entirely going to be helping clinicians understand how to order genetics, who to order it on, when you get it, how to interpret it, and then how do you go about treating these patients, what the long-term outcomes are.
Exactly, ma'am. Because as we know, HUS is not as uncommon as it was thought initially. With the better diagnostic procedures that we have in our armamentarium, it's become easier to diagnose, but a little difficult to differentiate whether it is antibody-mediated or it's genetical, and then working it up in a resource-limited setting, specifically like in countries like India. So definitely your inputs would be a great help, and we are acceleratedly looking forward to your talk at Icon 22.
Sure.
So, I would like to know from you, ma'am, what are your thoughts about, or what do you think about to WIN India in specific?
Okay, definitely. So I will say that, promoting the careers of women and standing up for women's rights is one of my passions. You know, outside of what I do clinically, I feel very strongly about roles of women in leadership. Women need to be out there and doing things and should be advocating for themselves. So I was very, very happy to see Win India come up. You know, I grew up in India. I did my med school there, and I'm very familiar with the culture there. And I've obviously spent the 20 years here. So I really understand where women stand in India. And I was very happy that you guys came up with this. And I have been beyond, thrilled because you all have brought it up to a very good level. The engagement that there is on social media, the level of conferences you guys do, involving international speakers, doing educational sessions. I mean, I really have to say, I have to kudos to you guys that you're able to do that despite everybody being busy in practice. So I am very, 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 very happy with the way Win India is going, and more power to you guys. And I just really want to see you guys thrive and take it to the next level.
Thank you. Thank you for your encouraging words, ma'am. That will definitely help us propel forwards. Another thing I would like to ask is, what is your message for women in general? Like, for somebody who is not a medical, who does not belong to the fraternity, what would be your key message to such women?
So I want to say for any women, no matter what they do, whether they're professional, they're homemakers, my two main things is that figure out, I say this, figure out your why. Why are you doing what you're doing, right? Is that truly where your heart belongs? Is that where truly your passion is? And it doesn't come easily unless you really sit down and introspect and understand, why you are where you are. Is this where you want to be? So figuring out why you're doing what you're doing. And no matter what your interest is, move forward, pursue it. There are going to be hurdles. Nothing ever comes easy. But I will say that go ahead, pursue your interest and follow your passion. And although it sounds cliched, but that is really my message to women, that do not hold yourself back. You want to go something, go get it.
Absolutely. Like women in India through the 75 years of independence have come across a long way. And women in nephrology in specific, we are sure that the numbers would outdo the men in nephrology very soon with the speed everybody's taking nephrology as their subject. So anything else, ma'am, you would like to share with us?
Not really. Like I said, I will say though, maybe that in the world that we are today, I think there couldn't have been a better place. I don't think we would have been able to have this conversation like you and me are having. So I do think that I think the social media has brought us globally together. Of course, it has its downs and it has its cons. But I think that if we can exploit this particular platform, there is no limit to what we can do. And I mean, we're already seeing this in front of us. So really, I think I have been really enamored by how social media has come along, especially in the medical community, and how we as nephrologists are utilizing it. And I am just happy to be able to connect globally with my peers, mentors, and I encourage everybody to do that, and especially, especially women in India, because I know that we tend to be siloed and stay in our own little, areas. But I think I want you guys to reach out, and I think all of us should do that.
Thank you, ma'am. Thank you so much for your words and for sparing time for Win Icon talks. And definitely, we are very eagerly looking forward to gaining knowledge from you at the conference. So about unraveling the genetics in HUS, yes, we want to learn that immense knowledge that you have from you, and we are actually very excited about listening to it.
Absolutely.
So,
Same here. Yeah,
so
definitely. And we'll see you shortly in a few days.
Surely, Sona.
Thank you. Thank you.
Thank you. Thank you.
Recording stopped.